Here are 11 reasons why medications are not a good idea for treatment of hip arthritis. Before I get into my list, I just want to say that medications can be useful at certain times for the right conditions. And they're absolutely necessary in some situations even, because they can make the world of a difference. I mean, even a life or death situation with the right medication. But when it comes to hip osteoarthritis, medications are generally not going to solve the root problem. In fact, let me be clear on that. They're never going to solve the root problem. They're only going to take away pain temporarily, or even just reduce it, not take it away. And that can be useful in some situations, but it is not solving the root problem, so it's not something that you want to rely on. Let me give you 11 reasons why. Reason number 1 is medications don't fix the root problem. The root problem of hip osteoarthritis is mechanical in nature, meaning there's a ball and a socket part of the joint, and they move together like this. And when there's a problem causing hip arthritis, there's usually too much force rubbing somewhere inside the joint, usually the front side of the joint. This is due to muscles that are pulling the ball off center on the socket, and it's causing that bad force to go through the joint. Over time, this is what sets up hip osteoarthritis. Pain medications don't fix that. They're simply affecting the pain receptors in our body. Meanwhile, this is still happening. The excessive force in a bad way is still happening inside the joint. Number 2 is false feedback. If you take pain medication, then you can get that pain dulled down, maybe even it goes away for a short time, and it gives people this false feedback that they're getting better. When in reality, it's just that the pain is less or maybe even gone for a short time. And when they get that sensation of feeling better, sometimes they go start doing more activity that actually worsens the forces inside the hip joint and aggravates the hip arthritis. This leads to my next point, which is masking the pain. Number 3, if the pain is masked, some people believe that the hip arthritis problem is resolved, that it's gone, but really it's just covered up. And that's not a good place to be. The way to use pain medication if you're suffering from hip arthritis, this is what I tell my patients all the time, is use it to get better sleep. It is probably a good thing for you to get enough sleep at night because you heal at night. And if you're trying to recover from hip arthritis because your cartilage inside your hip joint's messed up, it's injured, then getting a full night of sleep without having to wake up all the time because of pain is probably going to be a good thing. Now, you just don't want to rely on it night to night. There's other things that need to be resolved in order for you to not be taking pain medication on a consistent basis every night. Now, if you are taking consistent pain medication to mask the pain every night or every day, then that leads me to my 4th reason, which you're covering up the problem and you're just sweeping it under the rug. Meanwhile, it festers. The problem is going to fester. The real mechanical root problem of hip arthritis just grows. Your muscles get stronger where they're already strong and weaker where they're already weak, and that force going into the hip joint just gets stronger over time. It just starts rubbing that spot. And the medication is not really causing you to change the forces in your hip joints. Even healthcare professionals don't fully understand this. And when pain medications don't work like they're intended, or they work for a short time and then the effects aren't the same after you've taken the medication for a while, health professionals will say things like, well, this was only supposed to be temporary, but this is an age-related problem, which I disagree with, and it's just going to get worse as time goes on. But you need to realize that healthcare professionals are very highly trained at treating problems like hip osteoarthritis with medications, injections, and surgery, and none of these treatments fix the root problem, the mechanical side of the problem. The 5th reason that it's not a good idea to take pain medications to treat your hip arthritis is the cost. Now, you may not think that it's that expensive to buy like a bottle of ibuprofen, for instance. It may cost you about $10, give or take. Generic, name brand, all those factors can be factored in. And you may not even go through the whole bottle. Let's just assume that you're buying one bottle of pain medication that costs you about $10 every other month. Over the course of 5 years, that'll be about $600. If you spend $600 over 5 years, you may think, well, that's not that much. But think about this. If you don't get that problem resolved, what are the other side effects of this? You're still in pain. Potentially the pain's getting worse. Usually ibuprofen doesn't continue to help you after a few years. You need to switch to prescription strength stuff, different pain medications. People go get injections and eventually they give up and have a surgery if it's not handled properly. So what about the hidden costs of taking pain medications? I would invite you to consider that. If you go through the process of fixing the root cause of hip osteoarthritis, I guarantee you it's going to cost you a fraction of the amount of money that you'll spend on short-term treatments that usually start with pain medication, and you'll get all the benefits of being able to have a better quality of life because you could be on your feet as long as you want. You can exercise. You're not putting on weight or getting unhealthy in other ways because your hip's not letting you. You need to make sure that you treat the root problem. It's going to save you money in the long term. Number 6 is developing a tolerance to medication. This happens all the time. It used to be that one half pill of ibuprofen did it for you, but then over time you find that you're taking the whole pill, and then over time you're taking it every day, then multiple times a day, depending on what the bottle says you can take. This is what it's like to increase your tolerance, because you need more medication to get the same effect that you had before, which exposes you to other problems, the side effects of the pain medications. And it can also lead to my next point, which is dependency on a medication and also addiction. Now, with over-the-counter pain medications, it's not as much of a problem. It does happen, dependency and addiction, but this is more of a concern with the prescription strength pain medications, especially the opioid-based medications. This has become so much of a concern in recent years that doctors are not allowing patients to have opioid type pain medications, the very strong ones, as easily as they used to. They've even made laws in many states that make it harder for doctors to give you these opioid medications, and there's more red tape involved as well because of the dependency and addiction factors of these prescription strength pain medications. And number 8 is interactions with other pain medications. Now, if you're taking a pain medication, you have to tell your doctor, I'm taking a medication for this and that. And even things like supplements or foods that you're eating can also interact with a medication like a non-steroidal anti-inflammatory drug or even a steroidal drug. Those have a lot more side effects. And number 9, speaking of side effects, there's short-term side effects like some people get nausea, some people get constipation, some people have drowsiness or dizziness effects from medications. And then number 10, there's long-term medication effects, side effects. I'm talking about things like raising your blood pressure. That constipation can be so severe that you need a medication to treat the constipation. So now you're on a medication to treat a side effect for the pain medication that you started with for the hip arthritis. Some people can have their diabetes affected because certain drugs out there will raise your blood sugar, and now you have to switch diabetes medications, which can cause you all sorts of other problems. And there's some medications out there like prednisone that are known to cause mood changes and weight gain. And it's immeasurable how much it can affect you if your mood changes to the effect that it's messing with your relationships. And if you're gaining weight, that's going to set you up for a whole slew of other health conditions that you probably don't want. And finally, number 11 is the risk of overdose. Now, it takes quite a bit to get to this point, but it does happen. And there's some drugs that have some serious side effects when you overdose. Now, some you just don't feel good and people stop taking the medications, but other medications are more sinister. They don't have the effect come up gradually. It comes up more suddenly. So one of those is with NSAIDs, with medications like ibuprofen, for instance. If you're taking this medication around the clock for weeks, your chances of getting internal bleeding, which you don't always feel, those chances increase, they skyrocket, especially around 6 to 8 weeks. And there's association with hospitalization and even death because of ibuprofen use. Now, if you're just using it for a few days, then generally you're gonna be okay. Some people do have allergies, stomach allergies to this, and they'll tell you right away, I don't like ibuprofen. But most people will take this medication and not know that they're causing stomach lining problems that can cause a hole in their stomach and bleeding and some serious problems. And there's other side effects, obviously psychological side effects to this, and you just don't want to be in a situation where you're overdosing yourself with any sort of drugs. Now, I know this list has probably been scary to you potentially. I don't want you to think that medications are something that you should never, ever take. I just want you to move forward with the best knowledge possible so that you can take the best steps towards making your hip joint healthier. Now, I want to let you know that there are ways to naturally heal your hip osteoarthritis so that you're not having to rely on taking pain medications on a consistent basis. Now, here on this channel, I have tons of videos with exercises, tips, and advice to help you heal your hip arthritis naturally. I've put them all in a playlist. It's called the Hip Arthritis Help Playlist. If you find the description on this video, you'll see a link to that playlist. And you'll also see a link nearby that one for something called the Hip Arthritis Recovery Program. This program is a step-by-step process to heal your hip arthritis from the beginning to the end. It's my treatment approach that I use with my patients here. And I put it all into 30 plus videos that you can access right now. You can access it from anywhere, anytime, as long as you have an internet connection and a device with a screen on it, and you can begin to learn how I walk people through healing their hip arthritis naturally. Hey, if this video was helpful for you, please give us a thumbs up. Please share this with somebody you think needs to see this, somebody who's taking medications for their hip arthritis. They need to know, the dangers, the risks of it. And please drop a comment on here. Let us know if you've had any issues with medications in the past. Let us know if you've healed your hip arthritis. We know there's tons of people out there that are getting back to us all the time that have been positively helped by our channel. And you need to share your stories, because there's people watching this video right now that are probably skeptical of what I have to say, and they need to hear it from you. So please drop a comment on here. Please subscribe to our channel if you haven't already, and hit the notification bell so that you can be notified each time we release a brand new video. Thanks so much for watching. I'll see you in the next video. Bye-bye.